So, thank you everybody for joining us today. I didn't get a chance to introduce myself. My name is Melissa Wong. Work at Social Planning Toronto. I'm joined here by my colleagues Shannon Spencer and also our facilitator Diana Chan McNally. And so we really appreciate you joining us today. This is a really important discussion, and the reason that we are having this discussion is to help individuals and organizations really break down myths about homelessness and look at finding having more productive discussions around shelters. We know that there's been a drastic increase in homelessness. We know that there has been growing anti-shelter sentiment, anti-homelessness sentiment and rhetoric that's growing in our communities. And while we know that shelters are not the sole solution to homelessness, they are a critical step in the housing spectrum, and they help lead to long-term adequate and accessible housing. So we've been having these discussions at Social Planning Toronto, and we worked with Diana Chan McNally to create the Talking About Homelessness guide. And the purpose of this guide is to help you develop that strong and positive messaging. It has practical tools to respond um, to some of the negative comments and rhetoric and myths and around homelessness. So we're going to start with a presentation from Diana and followed by and a question and answer discussion period. And we'll also have a feedback form for you to complete at the end of the session. Um, and so I'm going to go ahead and introduce our speaker. I'm very, very excited. I'm very privileged to have Diana Chan McNally join us today. She's a longtime frontline community worker and advocate who's been advancing the rights of homeless people, particularly in encampments. As someone who has lived experience of social services and of being unhoused, Diana's work focuses on human rights and equity issues for people who are experiencing homelessness by advocating at the political level, while still maintaining an active frontline praxis. Diana is a frequent media commentator on issues affecting the unhoused and also teaches courses in community work. She is incredible at breaking down and in a really accessible way how to positively talk about homelessness and understand that how this is really a systemic issue. So thank you, Diana, for joining us today, and please go ahead.
Thank you. And yeah, unfortunately, too much of a media commentator. So I sincerely apologize. I also had some trouble logging onto the internet once I actually got set up. So thank you for your patience. And I hope it's well worth it for you. So much appreciation. When we kind of get to the discussion portion, if you want to put your name and your pronouns and actually write them into your little window to make it easier for us to interact with you when it comes to that time, please do so. Of course, I may ask you to also pronounce your name. Just so I don't muck that up, of course. Questions we'll leave to the end at the discussion period, and we'll start with the presentation. There will not be breaks because of kind of how we structure this and just for the time of the workshop. And as you know, we are recording just this portion, the presentation, as opposed to the discussion period. So to give people, some freedom to actually ask questions and bring up scenarios that may be a little bit sensitive as well. With all the workshops that I deliver, I have certain rights and responsibilities that are embedded. So I'll go through these. You have the right to feel safe expressing your own feelings and opinions, but you also have the responsibility to be aware of and attend to the feelings and opinions of others. You have the right to ask for what you want or need. So if there are ways that I can adjust what I'm doing, please let me know. You also have the responsibility to participate and contribute as much as you are able, so stepping up or stepping back. You have the right to be treated with respect and dignity in this space, hopefully in all spaces, but certainly here, but also the responsibility to treat others with dignity and respect, so listening while others are speaking. You have the right to be listened to and taken seriously, as well as the responsibility to be attentive, open, and non-judgmental toward others. You have the right to pass, so especially during the discussion period, you're not obligated to participate. If you'd rather take a back seat, that's absolutely fine. However, you also have the responsibility to self-reflect and take the opportunity to grow. Really important, and my favorite of these, is that you have the right to make mistakes. It is impossible to do this work perfectly, to talk about the issues perfectly, and to continue this work, even if you've been doing it for many, many years and not make mistakes. And I think it's okay that we acknowledge that and that we're human and that we're always in a process of learning. So, I've been working for 11 years in this field and I still make mistakes. I think that's something we should all be able to afford ourselves, is that we're not perfect. That's it. We do have the responsibility as well to be honest about our own energy and attitudes. So before we actually kind of dig into some of the content of the guide that's been published, I think I really want to dig into how we frame homelessness. We can't frame it in a good way if we don't understand the context of homelessness. And so what I'll be talking about is mostly specific to the city of Toronto, but having worked with communities all over Ontario, the context is very, very similar. The numbers might change, but overall the trends will be almost entirely the same. So it will still be applicable even if you're not in the city. And I think important for us to learn anyway about some of the context that's happening in Toronto in particular, but again, how that extends to other communities. So importantly, who is homeless? And part of what I dig into in the guide is that there is not one kind of person. We often have a stereotype of a person in mind when we mention homelessness. And more often than not, and there are actually studies that have been done into this, what people imagine when we talk about a homeless person is usually a middle-aged white man who is out on the street, someone who generally lives with mental health barriers, someone who also may be using drugs. But homeless people are every kind of person, but at the same time, there are certain demographics that tend to be overrepresented. And so Melissa had already mentioned that Indigenous people happen to be overrepresented, and that is darkly true in the city of Toronto, but also, again, in other communities across Ontario and indeed across Canada. In the city of Toronto, the population of Indigenous people is just 3%. They are 1/3 of people who are unsheltered in the city, which is grossly disproportionate to the number of people overall who reside in Toronto. So they're very much overrepresented among people who are homeless. At the same time, racialized people are also highly overrepresented. Toronto is a very diverse city. We have people from all over the world, most multicultural city in the world. So 52% of our population identifies as actively being racialized. But when we look at the numbers of people who are unhoused, who self-identify as being racialized, it's 77%, more than 3/4 of people. So again, there is overrepresentation of people who are racialized. Again, it's interesting that the stereotype is always of, generally speaking, a white man when we look at the context and see that the majority of people are actually not white. Black people especially are overrepresented. They are 9% of Toronto's overall population, and yet they are 58% of all unhoused people. And I think I have to give a little bit of context to this because what we've seen in recent years are changes in the law in countries like Uganda, in Kenya, across Africa, which have made it unsafe for queer people to actually continue to be residing in those countries. So they've come here to Canada as asylum seekers, as refugees, because we've purported ourselves on the world stage as being a safe place for people who are queer to exist. But unfortunately, we have different tiers of who is welcome in Canada when it comes to refugees. There isn't a consistent process for every group. And what we've seen with African refugees in particular is that there has been an absence of support and resources available to them. And that has created this disproportionate situation, especially right now. Not that this is unique necessarily. Black folks are always overrepresented in Toronto's homeless population, but right now this is being very much exacerbated by policy at the federal level, by a lack of supports at the provincial level that are leaving essentially African refugees stranded in our shelter system. So I think that's really important context. Again, this is not unique to just Toronto. All across Southern Ontario, we see the same thing. And in fact, what we've seen is that people do land in Toronto, and then IRCC, the federal branch that deals with refugees, they have been moving people to different shelters, not into housing, to different shelters across Southern Ontario. So overall in Ontario, we're seeing this high representation of Black folks, and in particular, Black folks from Africa and who are queer. And on that, when we look at queer folks, there are approximately 8% of Toronto's population, people who self-identify, but they are 22% of all unhoused people who self-identify. And again, there is that intersection between people who are refugees, especially from Africa, and people who are queer. And so we see that 31% of the population in the shelter system are queer refugees. So there's an intersection here that I think is often not named in the way that it should be. We often talk about African refugees, or we talk about folks who are queer, who may be experiencing homelessness, but we don't talk about that very strong intersection that is happening right now in our current context in the city. Seniors and youth are also very much overrepresented, and overall, they're about 20% of unhoused people. But what we're seeing is that seniors in particular are becoming the fastest growing demographic of people who are actually homeless. And as with everything else, this relates to affordability. What we're seeing is that seniors who are renters are no longer able to afford the rent. Even on OAS, even on GIS, which is the income supplement that's granted to low-income seniors, even with those combined social assistance programs, they cannot afford the rent. And for most people on GIS with OAS, it's about $3,000 a month that you're actually receiving, which seems not insubstantial maybe to some, but certainly isn't enough necessarily for people to actually afford a place to live anymore. And so again, we are seeing that people are now increasingly out on the street. And this is our fastest growing demographic, again, not just in Toronto, but all over the province and indeed all across Canada. So when we talk about income supports being not nearly enough, we talk about ODSP. We should absolutely 100% talk about ODSP the most, in my opinion. OW, but we also should be talking about seniors whose income supplements are simply not enough to actually afford rent. Now, importantly, and here's where I feel like this is where the biggest gap in knowledge actually exists, and not necessarily to the folks in the room. I'm sure most of you are very well versed in why people become homeless because a lot of you have been doing this work for quite a long time. But in the public narrative, in the public sphere, when we talk about why people are homeless, there is a lot of stigmatizing, a lot of stereotyping, and a lot of blaming people who are homeless for some individual flaw that may be perceived, which has created the conditions of homelessness for them. They did something wrong, or they are a bad person, and that is why they are homeless. And I think, really important to this is that it is not up to the individual. We create the system's gaps that people fall through because we choose not to actually support them. That's why people become homeless. And so I'm going to go through this just a little bit. The most important factor when we're talking about why people become homeless is affordability. Absolutely 100% affordability. Every person that I have ever worked with cannot afford market rent. That is the case. And so affordability is by far the most prevalent reason as to why people cite becoming homeless. It's the number one reason that people cite. In fact, 41% of homeless people in Toronto cite as their number one reason for becoming homeless the fact that they cannot actually afford the rent. They don't have enough money for housing. This is why they're homeless. And we've seen this actually in different municipalities as well. This is not, again, unique to just Toronto. I've seen in Sudbury, for example, it's almost exactly the same number. 44% of people in Sudbury self-identify that the fact that they cannot afford the rent is the number one reason why they're now in an encampment or in a shelter. So this is consistent across the province, is that affordability is the number one barrier that creates, again, the conditions of homelessness. And so, we have an incredible amount of homelessness in this province. And if you hadn't heard this number before, it's shocking. So last year, 81,000 people were homeless that we know about, that were counted by government counts. There are thousands, tens of thousands of people who are not counted because they don't intersect with social services, because they're couch surfing, because they don't talk to outreach workers. Tens of thousands. So when I say 81,000, that is actually a severe undercount, even though that number in itself is shocking. And again, if this is consistent, then you're looking at 40, 50% of people citing as their number one reason for becoming homeless is affordability. Can't afford the rent, can't find affordable housing anywhere. And even though Toronto's housing crisis, we exist in a bubble in Toronto and we kind of pretend like we're just the only game in town. Our housing crisis is the same as everyone else's. So there are no places left in Ontario where the rent is actually affordable. I would be remiss as well if I didn't talk about gender-based violence. And this, for some reason, isn't actually part of the overarching discourse when we talk about homelessness. 15% of people in the city of Toronto cite conflict or abuse from a spouse or partner, so gender-based violence, intimate partner violence, as the reason why they are homeless. This is a huge contributing factor. So it really irks me when we talk about somebody did something wrong, they're a bad person, when we have situations where people are experiencing violence, who are now becoming homeless as a result of that. These are not bad people. These are people who are very vulnerable and need good supports. So this is a huge contributing factor, as are unmet health needs. 75% of people in the city of Toronto say that they need help accessing a family doctor. They don't have a family doctor. We know that millions of people across the province don't have a family doctor, and we see a high intersection of not having access to primary care and homelessness. And so we have to think about, illness, injury. People can't work as a result of that. They encounter more barriers because of illness, of disability. And so because they have these unmet health needs, they're put into positions where they can't manage to pay the rent. Again, this intersects again with affordability. Or they face landlords who are stigmatizing to them, who do not want to rent to somebody who has a chronic illness, who has a disability, for example. So there is a high intersection of these unmet health care needs and homelessness as a result. And I think really important to that is that it's not just, one healthcare need. 64% of people identify that they actually have multiple health challenges. And the longer that they stay homeless, the more challenges they will actually experience, the more they compound. And when somebody has these multiple health challenges compounding, it is so much harder once you become homeless to actually find and secure and keep housing once you're in that position. So homelessness is very debilitating. It's highly disabling. It will create health conditions simply because you're existing in it. And as a result of that, it makes it even harder for you to be housed in the long term. So it's really egregious to me, again, that we talk about this as being like someone made some vital mistakes in their life. This is why they're actually in this position. When we look at these things, again, these are all about gaps in policy that address the fact that the rent is too high, that wages are too low, that we don't have adequate rent controls, that we don't actually consider gender-based violence and IPV an epidemic and actually have supports necessary for people in the situation, that we don't actually have a strong healthcare system. It's eroding, and we don't have enough family doctors, and people certainly attached to those family doctors. And what brings all of those pieces together, you might realize, is actually the province. It's the province. All of these are provincial levers, policy levers. And so the conditions of homelessness, while other levels of government are absolutely contributing factors here, we really have to look at the province first and foremost for creating the conditions of homelessness that we see across Ontario, in Toronto, because these are the things that they ultimately control. And just to speak a little bit more about affordability, here we have a graph. This is taken directly from the City of Toronto about what the average market rent for a bachelor unit, and a bachelor unit is just a room, essentially. Bathroom, might have some kitchen facilities. The average market rent on that is over $1,400 a month, almost $1,500, right? And then we look at social assistance. We have on the bottom that orange line there. That's how much you receive for rent if you're on Ontario Works. $390 a month. You are over $1,000 short every single month to afford the average market rent on a bachelor unit. And we look at disability, which is the green line. $582 a month. Again, you are almost $1,000 under what is required to actually afford rent in a private market system. So, if homelessness is in itself massively disabling, and the number of people that I've worked on who have had to go on to ODSP as a result of their situation is most, to be honest, most. You are put in a position where you are legislated into poverty. You are not given the money that you need to actually afford to live. That is very clear. That's very clear for people on OW as well. And as I mentioned before, it's also very clear for seniors who are on income support. So when we talk about affordability being the number one barrier, it's important to note that this isn't just about earning money through wages. It's about the fact that social assistance rates, which again are legislated, ODSP and OW by the province, senior supports by the federal government, they are not enough. They force people into poverty, and into homelessness on purpose. So when we're talking about homelessness, we absolutely create homelessness because we do not give people enough to live and do not respect the human rights of people who are living with disability. And as I mentioned, of course, low social assistance rates, but for those who are earning income, wages are low. They're much lower than what we can actually afford out in the world, trying to afford market rent. And we see that rents are rising far, far, far faster than wages are certainly rising. And so, again, we have that disparity between what people are earning through employment and, again, what they can actually afford. And this is exacerbated by a lack of full rent controls at the provincial level. We saw when Doug Ford took power in 2018 that he rolled back rent controls for any new buildings, meaning buildings created after November 15th, 2018, so that the landlord could charge at any point whatever rent they wanted. There was no limit to what they could actually charge. At the same time, we have loopholes, vacancy decontrol, for example, where it makes it very landlords, I should say, sometimes want to evict a tenant because they want to raise the rent because they want more money. I've been evicted 3 times. All 3 times it was bunk. 2 times it was because the landlord said they wanted to move in or they're going to move in their mother. She lived in a brick and mortar housing building in Leslieville. She wasn't going to move into my basement apartment. And then one time I was a victim of Achilles, if you're familiar with them, where they stopped fixing everything in my apartment. It didn't fix my toilet, and I actually couldn't live in it anymore. And these are the ways that landlords try to push out tenants so that they can suddenly jack up the rent and make more money. And because we don't have that rent control, especially in between tenancies, we see that there is a lot of folks, we see many, many folks who are being evicted in the city of Toronto, but all across Ontario as well. And what's, disturbing to me is that if we look at the average rent that someone pays who has been living in a rent controlled building for a period of time, it's actually $512 lower than somebody who has faced a recent eviction. So there's a huge disparity in what people pay, especially once they've actually been evicted. And overall, this is based on the concept of financializing the land. It's very much a Western colonial concept that you can own the land somehow and extract monetary value from it instead of considering it as a right, housing as a human right, as the land is something that allows us to actually thrive and be safe. So all of these things kind of coalesce to ensure that we value property way more than most of us are actually able to pay. Again, that lack of access to healthcare, so an inability to address, disabling health conditions, the constant trauma that actually comes from being homeless, not just necessarily people's traumas in the past. And a lot of folks that I've worked with have absolutely lived through horrific traumas. Every Indigenous person I've ever worked with is either a direct survivor of residential schools or the child of someone who did survive residential school. So, there's a lot of trauma, intergenerational trauma, personal trauma that exists in people's history. But it's really important to understand that being homeless is in itself constant trauma. So when you're working with people who are in that state all of the time. There's no reprieve from that. And I think that's important to recognize that this isn't something that exists in the past. It's ongoing until essentially it's over. And then we also have to deal with what's happened. So PTSD, essentially. We also have inadequate amounts of supportive housing, very inadequate amounts of supportive housing. And, the longer someone is homeless, and we have lots of chronically homeless people across Ontario and in the city of Toronto. The longer you're actually homeless, the more you will need supports because of how disabling it actually is. And so, ideally, we don't have people ending up homeless at all so that we don't need as much supportive housing as we do. But because of the situation we're in, because we're leaving people to be homeless for years at a time, we do need that supportive housing, and it simply doesn't exist at the level that's actually required. And of course, I would be remiss if we didn't talk about racism and discrimination and colonialism. And when we looked at who is homeless in the city of Toronto, we see the intersection of all of these isms creating the conditions for certain groups to be overrepresented among the unhoused population. Anti-Black racism has been the most prominent, I think, in recent years, but of course, every form of discrimination can coalesce to, again, ensure that certain groups are having their human rights violated, quite frankly, and not able to access the resources that they actually need to be healthy and well. I also have to talk about drugs and mental health. And what I've noticed is that the narrative in the past couple of years has really changed. I look at the United States in particular, and what tends to happen in Canada a lot of the time is whatever happens in the States, we kind of get a year or two later. And the rhetoric that I started noticing in the US has now carried over into Canada. There used to be in the US bipartisan support for something called Housing First, that the way to address homelessness was to give people housing and then provide supports accordingly to whatever it is that they need. There is something called the Cicero Institute, which exists in Texas, and they created a different set of policy guidelines that they have been shopping to municipalities, to states, to the federal government in the United States. And what the Cicero Institute has been purporting is that the reason why people are homeless is because they use drugs. They're all addicts, and they're all living with mental health conditions. They're quote unquote crazy. And this is what I'm now noticing in Canada. I've heard this from the premier. I've heard this from conservative pundits that the reason why people are homeless is because they can't stop using drugs. And the solution to homelessness is that we put them in treatment, forced treatment. And this is very dangerous. Uh, and it's important that I address it. So if we actually look at the data again, reasons for housing loss. Again, this is a graph that's taken from the City of Toronto's own documents. Reason for housing loss. Number one, not enough income for housing. But we look at mental health issue, we look at substance use issue. Again, this is people who are self-identifying. It's well under 10% for both of those categories, and there's most likely an intersection between those two. So we're talking about over 90% of people saying that this is no bearing on my being housed or unhoused at all. It's actually a very small proportion of the actual homeless population in the city that consider this as a contributing factor. So it's, fascinating and highly incorrect that we're talking about mental health and addiction as being, again, that primary cause of homelessness when we can see the vast majority of people do not consider this a factor at all. But what's really important to note is that what happens after you become homeless. And so while the vast majority of people will not cite either living with a mental health condition or using drugs as a contributing factor to becoming homeless, there are a lot of folks who will identify it as being a factor once they have become homeless. 44% of people report living with a mental health challenge once they've become homeless. That makes sense to me, unfortunately, again, because it is such a traumatizing condition to constantly be in 24/7. Again, for people, a lot of people, years at a time. It makes sense to me that that would have a toll on your mental health. It absolutely would. 25% of people also report living with a substance use challenge versus those who self-report it being a contributing factor. Now, at the same time, that's also saying that 75% of people don't believe that they have an issue with substances. So again, that stereotype of someone who is quote unquote crazy, quote unquote an addict, has no real basis in reality at all. While it is much higher incidence of people using drugs or living with mental health barriers once they become homeless, that is actually the key. That it's homelessness in itself that causes these issues. It doesn't happen beforehand, it happens once you've actually lost your housing. These are factors afterward. And so when we're talking about these issues, this is really, really, really important to note that difference, that these things happen because we make people homeless. And of course, because there's this pervasive stereotype that people use drugs, that they have a mental health issue, um, everyone always says you got to clean up your act. You got to get healthy, you got to get better, and you got to do that by yourself, or we're going to force you into facility to do that. Substance use treatment, it's so important that I talk to you about this. It is not regulated in the province of Ontario, and it is mostly privatized. Think about that. This is a service that costs money, thousands of dollars. There are places, facilities, private facilities that cost $15,000 a month, for example. And it is not regulated, meaning that there are no standards, no medical treatment standards that need to be incorporated into the services and that are monitored. You're talking about a grift in a lot of cases, unfortunately. And there are numerous articles from the CBC, the Toronto Star, that detail situations where there is a substance use treatment facility, which has offered no real support, that has cost people lots of money, and that has actually harmed people, and in some cases actually led to their deaths. So we can't describe it as a panacea in the system that we currently exist in. What we do need are treatment beds that are regulated and that are voluntary and that are evidence-based. But we don't have those, and it's often not part of the argument. And importantly, if you don't have stable housing, it's very, very, very difficult for you to essentially have the stability that you need to manage substance use, to manage a mental health condition. So we do need that housing first before someone can even be in a position to actually broach things like maybe wanting to use substances less, or the trauma that they've been living through as a result of being homeless. And, again, voluntary treatment beds, very, very few and far between, not widely available. And I think also, unless you're working frontline, you don't necessarily know this. So I've had many, many people ask me, I've been a case manager working frontline for 11 years, and people have asked me, I want to go to detox. I want to stop using drugs. I want to not use them as much as I do. If we can get them a detox bed, and sometimes we can, what we can't do is transition someone from detox and into a voluntary treatment bed. There aren't enough. It is easier to access detox because there's a 2 week, it's only a 2 week program, and essentially you cycle out. To get into treatment is a longer term stay, and there aren't enough beds. I've worked with people where they've gotten out of detox, and suddenly the wait to actually get into treatment is 6 months. It's 9 months. It's a year. And during that entire period after detox and into getting into that bed, they cannot use drugs. And if they do, they will no longer be eligible for that bed. That is incredibly high barrier. So, when you're talking about these things and trying to debunk some of these arguments, it's important to know that the system of drug treatment in Ontario is very broken. And it's something that we don't actually want to talk about. So I'll just reiterate again that without safe, stable shelter, without housing, treatment is ultimately not very effective. And even when you do have housing, people often go to treatment multiple times. This is not a one and done situation. So important, I think, to debunk those pervasive myths about everyone having a mental health illness, about using drugs, because the situation is obviously a lot more difficult and complex than the media and certain pundits will ever actually talk about. With harm reduction, again, this is also something that's being maligned. There's over 40 years of research in public health, evidence-based. It shows that it is a very, very effective intervention to save lives. We have, unfortunately, a war on harm reduction right now that is in tandem with suggesting that all people are homeless because they use drugs and because they're quote unquote crazy. These things are happening at the same time, but harm reduction is very effective and it absolutely does save lives. And we all have human rights. It is the law. No one should be relegated to death because some people will judge their actions or behaviors. This is actually protected in the Canadian Charter of Rights and Freedoms under Section 7, which is the right to life. No one deserves to die just because we think that something that they may have done is wrong. That's a fact. We just do not have that in Canada, but there's this kind of increasing idea that, well, they did it to themselves if they're using drugs. They deserve to die, which is disgusting, but also, again, extremely common at this time, I would say. Uh, Also really important is that living with an actual diagnosis for mental health conditions or substance use disorder, this is also considered a disability under the law. This is a disability under the Charter. It's a disability under the Ontario Human Rights Code. And so there is an actual legal duty to accommodate people on the basis of it being considered a disability. And that often gets lost, I think, in the rhetoric as well, is that we, again, think of it as some kind of inherent flaw. When people do live with mental health diagnoses, when they might have a substance use disorder diagnosis, these are actually considered disabilities under the law. Now, one of the things that makes me bonkers is that when we talk about homelessness, we think about it as like this intractable problem. There is no solution to this. We just have to live with this forever. And I feel like a lot of governments in particular actually think about it that way. Oh, it's too big of a problem for us to actually solve. So, we might throw a little bit of money into some emergency solutions, but we're not going to actually stop uh, homelessness or end it overall in Toronto, in Ontario, or across Canada. But, we talk about solutions and we're here to talk about supporting shelters. Super important to understand that shelters are actually an important part of solving homelessness. But overall, if homelessness, as I've talked about, it is a systemic issue, not an individual flaw, not an individual issue, it requires systemic solutions. So we do need broad policy changes, again, lots of them at the provincial level that address affordability, things like ODSP, OW, wages, rents, access to healthcare, also provincial. So, a robust public healthcare system where people can access the care that they need when they need it. Housing, not just any kind of housing, which I think sometimes has been what the government has purported. We need supportive housing and we need deeply affordable housing for people. So we do need these broad policy changes, but we also have governments that don't want to do anything about it or drag their feet around it because it just seems like, oh, it's too much to actually solve this problem. So yes, it's intractable and we'll just go on our merry way. But there are interim and long-term solutions that can get us to ending homelessness, the ultimate solution being housing, but shelters are an important part of that actual continuum. And what are shelters? Well, I'm sure there's shelter providers in the room. You know what you do. But they are an interim emergency solution to homelessness. And they do very, very important things for people. Again, as someone who's been working with folks who are unsheltered, living in encampments for years now, the ability to sleep is something that we don't talk about enough. You can't sleep for more than 1, 2 hours at any given time when you're out sleeping in public. You will be woken up because it's noisy, just because someone's stealing your stuff, because you're being assaulted. There's so many reasons why it's so difficult to get that regular rest. And if you know yourself, what happens when you don't get a full night's sleep? How do you feel? How does that impact your physical health and your mental health? It takes a toll. Now imagine doing this for long periods of time where you're only taking these short bursts of rest. Shelters provide the ability for people to have a full night's sleep. And that is a huge, hugely important health intervention. They also allow people to be able to store personal belongings. Now, not a lot, generally 2 bags of personal belongings, but having worked with people in encampments, when an encampment is evicted, the things that people lose are truly heartbreaking. This is not just about ID, it's not just about medications, both of which are so vital and it's deeply dangerous for people to have these things taken. I'm talking about wedding rings, I'm talking about people's ashes. These things get thrown away and it's so beyond sad and debilitating to know that you may not be able to hang on to these very precious objects. That takes a huge toll on your sense of identity, your material self, when you cannot actually keep these things. So being able to store your personal belongings safely in your own locker is hugely important for people, huge for their identity and their material self. And again, regular meals and nutrition. What people don't realize about being homeless, especially when you're unsheltered, is just how much walking and traveling you're doing. You're going to this location to get a lunch at 1 p.m., but then you got to go halfway across the city to go talk to your worker about some other thing. And then you got to go, again in the other direction to maybe go to a health appointment, for example. You are constantly traveling to go meet your basic needs. And this can help eliminate at least one of those needs by providing you the space that you're sheltering in a decent meal. So good nutrition. And of course, you can't get healthy if you're not eating decent food. That's just a fact. And so nutritious meals, regular meals are such an important thing that you need to be well. And that's something that shelters actually offer to people. They're also a doorway to essential services. So social services, housing help, case management, and health services. So primary care, harm reduction. Some shelters have amazing harm reduction programs, even supervised overdose prevention sites that are embedded. These things are accessible within the shelter, and a lot of people may not yet be attached to them, so they can access those services while they are there. And really important is that shelters are a pathway into permanent housing. Uh, Again, I've been doing this work for a long time. There have been points where we have not had nearly enough housing workers in shelters. And so I have to applaud the City of Toronto for trying to change the direction of shelters. Um, there have been very unsafe shelters. There are lots of people who have been extremely traumatized by their experiences in a shelter that come in the form of stolen items, that come in the form of assault and sexual assault, of overdosing in that space, of having friends overdose or die in that space. Deeply, deeply traumatizing experiences. And I don't want to suggest that these things have never happened because they are definitely a part of people's experiences. But at least in the City of Toronto, we're trying our best to address this by building smaller shelters. So not, the giant warehouses of yore, but rather smaller spaces that are 50 to 80 beds with more intensive supports embedded in them, more privacy, more private storage space, more accessible features built into the building. What I've seen in one shelter is that they have tons of recreation space and a patio. These are new features that make it a more sustainable, decent environment for people to be in. This is great that they're actually doing this and increasing those essential supports, but also recognizing not just the essential things, but things like recreation, a space to actually be outdoors that's semi-private, for example. And importantly, again, this is a place that people can to stabilize, get connected to a housing worker because we're also bringing in more housing workers, and then be expedited into permanent housing. I already mentioned, yeah, shelter safety is an ongoing concern. I don't want to pretend that it's not. We have about 300 people living in encampments in the City of Toronto right now. Over the years, we've seen, I think, at least a couple thousand that are known about, that are known to the City of Toronto. There are definitely some that are absolutely not known to the City of Toronto. I look at Scarborough, I look at North York. There's not a lot of outreach that's going into those areas. So as far as we know, we have about 300 encampments in the City of Toronto, and we hear from a lot of encampment residents that they will not go into the shelter system because of their experiences. Absolutely valid. And in fact, they have a legal right to shelter and housing offers that are truly accessible to them. This is what has actually been set in the law through a legal precedent in Waterloo in 2023. So not just any offer of shelter, but something that's truly accessible. And what I haven't seen tested in the law, which I'd be curious and interested to see tested in the law, is if you have experiences of being traumatized in a shelter, is any shelter space actually truly accessible to you? I would argue that it may not be. But again, we don't actually have that prescribed in the law as of yet. Um, I mentioned the size. Oh no, I didn't mention actually that we're also embedding shelters across neighborhoods in the City of Toronto. So we're not just saying homelessness is a downtown urban thing, because it isn't. What we've seen, especially since the pandemic, is that we have homelessness in every corner of the city. My family members, my parents, they live out in Rexdale, which is where Doug Ford is, unfortunately, our premier and our representative. I had never seen homeless folks. I had never seen encampments out there in years and years and years until the last few years. And so we're seeing in more remote locations of the city, hard to get to parts of the city, that there are absolutely encampments. And again, this is not unique to Toronto. I have talked to Kenora, I've talked to Thunder Bay, I've talked to Grey Highlands, which is highly rural, and just all different municipalities, urban, suburban, rural, and all municipalities are dealing with encampments. Burlington has encampments, and they are the richest municipality in Canada. So this is a pervasive problem everywhere. And it's important that we embed shelters where people actually are. And we're seeing that people in Rexdale, in North York, in Scarborough, in South Etobicoke, they are becoming homeless in their neighborhoods. And so they need facilities in their neighborhoods because this is where they feel comfortable and this is where they may already be accessing supports. We also have a shelter safety plan that's been developed, and this has been based on research from CAMH that is taking into account safety for staff, but importantly, also safety that folks have self-identified they need, the resources they need to feel safe in a shelter. We're taking that into account and trying to embed that into all of our new shelters. And a feature I really like about the new shelters that are going to be built, again, we have 20, is that they can be converted into permanent housing. So if please, we start to see the homelessness crisis start to come down, at a certain point, we can actually turn these into permanent housing because they won't be needed as emergency shelters anymore. So again, in framing homelessness, it's important to realize that homelessness is very diverse. There's not just one kind of person. It's a systemic issue. Again, it's policy, government policy that creates the gaps that people fall through no fault of their own. And so important, we can actually solve homelessness. And shelters are a really important piece of infrastructure that is going to get us there. So I want to talk a little bit about interpersonal communication techniques when we're talking about homelessness. And so if you've read the guide that we've developed, there are two approaches that are outlined. And really important is that they're not mutually exclusive. One is a community-oriented approach, which is kind of connecting with people who are motivated by collaboration. They're motivated by collectivity. They have an interest in community organizing, volunteer work, even charitable volunteer work. They might have a religious affiliation, or these are just the views that they generally espouse. We also have a self-benefit approach. So this connects with people who view themselves as self-reliant, who are motivated more by personal security, stability, and success. And I want to steer away from judging people who might be more inclined toward the self-benefit approach. People are dealing with a lot right now, and I'm trying to be very sensitive to the fact that people's emotions are very heightened in this moment. And so there is kind of this greater inclination toward self-benefit as a result of that. And I realize that comes out of fear. Fear of becoming homeless, of losing something, of some part of your life being peeled back. And that is very stressful for people. So I'm being, gracious in not labeling or judging people who might be more inclined toward this approach. This is not exclusively true, but it might be a better approach for folks who espouse business interests. Oftentimes for parents of young children who have learned a lot of misinformation from the media, from social media. And interestingly, for people who have actually been unhoused. And I will say personally, this actually used to be me. I thought for a solid 10 years, and I was homeless when I was a teenager for almost a year. I thought that I did something special. I got myself out of homelessness and I deserved, praise or benefit for actually doing that. And anyone else who didn't do that, they just weren't trying hard enough. It's embarrassing for me to admit that's actually how I used to think. So, be again gracious with people with these attitudes because it takes time sometimes for them to change, but it is not uncommon to hear something similar from people with their own experiences of homelessness that you don't want to believe that it wasn't just you that got yourself out of it. But I have a lot of privilege. I'm educated. I am white passing. I had a huge network of people in my corner, and they're the reason mostly why I managed to get out of it. So, be gracious with people. Try to be sensitive to the fact that, if they are espousing attitudes that seem to be stigmatizing of homeless people, these can often come from very complex experiences. So kinds of community-oriented messaging, a lot of this is in the guide as well, but we're talking about when we have housing for all, communities are safer. Safe, accessible, and decent shelter makes our neighborhoods healthier for everyone. Strong communities start with safe shelter for everyone who needs it. And what ties all of these statements together, this kind of messaging, is that it's about welfare of the broader community. It's connecting all of us together, and that safety is a shared effort. When one of us is safe, that's right. Okay, so when one of us is safe, all of us are safe, and we want to make sure that all of us are safe, right? It is not about competing interests or saying, this is the rights of children versus the rights of homeless people. That's a false argument. If everyone is housed, it's safer for absolutely everybody, right? So making that connection and not making it a fight between particular groups. As well, kinds of messaging that kind of align with the community-oriented approach. Everyone deserves safe, accessible, and decent shelter until we have housing for all. It's up to us to make sure our neighbors have safe shelter and aren't left out in the cold. These kinds of statements are about social responsibility, that it's not just us pointing at the government saying, you got to do this, but all of us has some piece of responsibility in our communities to ensure safety for all. So it's really about speaking to people's sense of civic duty. And people love to get involved. In my experience, they really want to help out. They want to be engaged and they want to express social responsibility. So if you're talking with folks who espouse that kind of view, emphasize that kind of messaging, that it's about all of us can do our part to actually end homelessness. Self-benefit messaging, again, isn't about underscoring stigmatizing attitudes. It's not about underscoring stereotypes. It's kind of flipping that on its head. So, some of the messaging that you might hear is a stable home for others means a more secure neighborhood. If we want to see less visible homelessness in our communities, then we need to house everybody. And this is speaking to the fact that people don't like seeing homelessness because it's upsetting. It upsets me. And I think a lot of people also just again, have a lot of misinformation around who and what homeless people are. And so there's fear that's been built up as a result of this. But ultimately, wherever you're coming from, the solution is to house everybody. So don't emphasize or buy into stereotypes, but really kind of emphasize that the solution ultimately, no matter what you're feeling, and we can even be on two sides of the fence on this politically, the solution is to house people. As well, other kinds of self-benefit messaging, giving people safe shelter reduces strain on the services you rely on, like emergency healthcare and police. And so this is about stressing, if we have housing for everybody, this actually is a personal gain for you. That means that you'll have less folks in the emergency room who are, creating backlogs. You will have police be able to actually solve violent crimes and serious crimes instead of moving people along who have nowhere else to go. So this is speaking to that sense of personal gain, what someone can actually get out of it, which can be really motivating for certain audiences. And ultimately, the most expensive place that anyone can live is actually the street. When we talk about the cost of healthcare, we talk about the cost of policing, we talk about the cost of social services. All of these things cost so much more than rent, so much more than shelter. It is by far the most expensive place we can let people live is out on the street. I think really important to interpersonal conversations is that this isn't about winning an argument. And, for better or worse, I see that kind of conversation happening a lot, mostly online. It's harder to do when you're in person. We're more inclined to be empathetic when we're having a real in-person conversation, but it's not about winning an argument. If we're actually trying to change hearts and minds, then arguing with someone, saying nasty things to them and attacking them is not going to change their position because it certainly doesn't work on us, right? So try to be open-minded, non-judgmental, try to not bring personal criticisms into a conversation. And what I tend to do is really address how someone's feeling, their apprehensions, their anxiety. And I do that by being empathetic and then presenting them with facts. And I also often kind of emphasize that further with my own stories. And I have lots of stories from working on the front line that help people to understand why homelessness exists and what the solutions are. So, if people are not 100% on side, really focus on how they're feeling, present those facts, and then bring in stories and narratives that might be compelling. Now, none of this is to suggest that you need to talk to somebody who is being a bigot. Anti-homeless bigotry is very widespread, and there is a significant difference between talking to someone who is having a good faith conversation, who may not be 100% on side, and someone who's already made up their mind and just wants to make you look silly and make you feel bad. So in these kinds of situations, I walk away. I just say, it doesn't feel like this is a real conversation that we can have. Like I'm ready to have that conversation whenever you are, but for now I'm gonna walk away. That's generally what I do. And they don't take that very well necessarily because they want to have that fight, right? But it is the best way to just exit the conversation and not get into a space where we're being triggered or hearing things that are really awful and potentially very personally detrimental to us. Now, because your organizations, in terms of public messaging, media work and public messaging are really, really essential. They are really, really essential in influencing the public narrative and in influencing politicians. And I actually have two comments to make on this photo that I've chosen. I did this on my birthday. I was on the agenda, and this was a couple of years ago when there was a lot of discourse around the TTC being safe because of homeless people. And there had been an awful incident of a man who was unhoused who had stabbed a young person who was on the TTC. And no one had crafted the public narrative at this time. And so I was like, please put me on whatever. I'll go on anything. And I want to try and take the narrative and put it in the direction it needs to go, which is to say that we do need housing for everybody, that we don't have appropriate health and mental health supports that are offered by the province, and that the solution is not to criminalize people because being homeless and living with a mental health condition are not crimes. The solution is to provide those systemic resources that we actually need. So I went on immediately and tried to steer the narrative in a good direction. So it's essential to do this kind of media work. That said, the agenda is not necessarily the best place to do this because no one watches the agenda. Politicians watch it. So it was important for that, but general public will be like, who's watching Steve Paikin? Who's watching the agenda? Unfortunately, nobody. So, I'll talk about that in a minute, but it is important to use these vehicles to try to get the messaging that needs to get out there to the right people. So it's important when you're talking that your message is clear, that you're succinct, and that you're easily understood by your audiences. And one thing that I think we often do and should not do is talk about every possible nuance and just spew facts at people because it goes over their heads, especially in media interviews. With social media, I'm actually really critical of social media. It's not as important as you think for getting your message out there. Um, it's important, but it's only important because people think it's important, if that makes any sense. It is not an accurate reflection of the real world and what real people actually think. It's a very distorted perception of that. So you often get these like high-level binaries of one way of thinking and another way of thinking, which doesn't actually show that the vast majority of people are frankly, somewhere in the middle of that. So use it. And the most important reason to use it is that journalists look at it, politicians will look at it, certain high-level figures will look at it. But for reaching the general public, it doesn't actually do that very well. When you're talking, when you're delivering your message, think about your angle. Who is your primary audience that you're trying to persuade? Are you trying to persuade a particular government official? Are you trying to persuade, a city staff person? Are you trying to persuade the public to join in your cause? And how are you actually going to do that? So, how are you gearing your messages to that audience using what language and using what platforms? And I have this graphic here because I wrote an op-ed in the Toronto Sun that mysteriously they actually accepted. And it was about the Canada-Ontario housing benefit, which the Ford government delayed last year, is cutting this year, which is an essential program that expedites people into housing. And if I had talked to Toronto Star, if I had talked to the CBC, right-wing audiences wouldn't have heard the message. And I needed right-wing audiences to get upset about it because they're tired of looking at encampments. So I wrote this for the Toronto Sun to get at Ford's actual base and to get at Ford because he reads it too. And it was criticizing him for creating encampments, for facilitating encampments that we all have to deal with because he won't actually give out the Canada-Ontario housing benefit. And after I published this, 3 days later, he actually dispensed the money. So it's really important to consider not just how your messaging is going to go out, the kind of language you're using, but where it's actually going to go out. So be strategic about that and be really kind of condensed in what your key messages and main points actually are. Don't overwhelm people with all of the nuances because psychologically, the human mind always wants simple answers. That's what we want. And when we get a lot of complexity, especially in the media, we tend to not be able to absorb that very well. So stick to, one to three key messages only. And I would say even three might be a little bit too many. One to two, ideally, because that's what the public can actually absorb. This is the part I really hate, but I also have realized it's really necessary. Just keep repeating yourself. Never stop repeating yourself. I was talking to North York Harvest Food Bank the other day, and I was like, aren't you tired of just repeating for the last 40 years that, food is a right, that food banks aren't the solution to systemic hunger? And they're just like, yes, you have to keep repeating yourself even for decades. It's how we make our narrative stick. You may feel just so tired at having to repeat yourself again and again and again. But when we have a simple message that people can understand and we just keep saying it over and over and over again, that's when we start to change the public narrative. So before you talk to the media, I think this is really important, or talk to any audience, you have a town hall, even a staff meeting, practice your talking points out loud before you actually speak. So get familiar with them. And if you keep doing this for years, like I have, they'll just be, you can just pull them up at the drop of a hat because you already know your messages so well that you don't really need to even think about them anymore. They're almost instant. Try to anticipate questions. I don't always know what a reporter is going to ask me. I don't always know what an audience member is going to ask me. But more often than not, I get similar kinds of questions. And as you continue to do this work, you'll be able to anticipate questions that you might receive a lot more easily. So when you think you're going to get a message, write down, or a question, write down your response ahead of time and practice it as well. So I've done media training with politicians. I've done media training with nonprofit leaders, and we do drills. So I will ask them a question and they have to have a response ready that they're practicing. So even having someone you can drill that with will be really important, I think, to answering questions really well and not being taken by surprise as much as possible. We will all get taken by surprise here and there, but it's best not to be, right? This is really important because I see a lot of agencies and organizations involve stories of people lived experience. It has to be done ethically, and I hate to say, I see more often than not that I don't know that it's been done ethically. Um, if anyone from the city of Toronto is in the room, I apologize. But they share stories of, I think it's called My Home Mondays, where they've actually had stories of people I know and have worked with, people that actually even worked for me, that they've used their stories to communicate how the city is expediting people into housing. I know from talking to those people that they did not know that their story was going to be used all over social media along with their photo. Some were okay with that, and that's absolutely fine. But there were people who weren't, who wanted to distance themselves from being homeless and didn't want their photo out there as being a formerly homeless person because they were worried that, family members, that job prospects, that there would be stigma actually attached to that. So when you're actually using those stories of lived experience, you have to have ongoing informed consent from those folks to speak about their experiences and also about how their stories will be used. So even if it's published once in a newsletter, you want to use it again or you want to talk about it, make sure you talk to that person ahead of time and get their consent to make sure that it's okay because they may change their mind. They may be applying for a job, for example, and may not want that story to be out there publicly because they're afraid it might actually affect their job prospects. I think really important too is that we have good supports for people through that consent process. What often happens when you're homeless, and I can say this from personal experience, is that you have to tell your story to every worker that you meet, every person that you meet, just to be considered a human being in need of support. It's exhausting. It's also really upsetting. And so, I want to acknowledge that telling your story can in itself be harmful and triggering. So make sure that there is support for people, that they have someone they can talk to, a quiet room that they can go to if they need anything, that they know that they can ask for it and that it's actually available to them, because it can be traumatizing in itself to tell those stories. When the stories are being communicated, focus on systemic barriers. What is really important, and what I see sometimes when people use these stories in their communications is that they focus on the individual, how they got themselves out of homelessness. It's not about that, right? Because homelessness is not about someone's individual, capacity. It's not about them being a good or bad person. It's about navigating the system and having the right supports there to actually no longer be homeless. And it's also about all of the barriers that are in place that prevented them from being able to access and afford a home. So make the focus of the stories really on those systems barriers, because that's what we actually need to address and attack. This is a hard one, and I really want to acknowledge this is hard. Not of all of our staff in our organizations, all the members of our agencies, or even our grassroots orgs, will have a common understanding of homelessness. They won't. Uh, I know as much as anybody, especially in our field, we have a high level of turnover. I teach at George Brown, and so I've had agencies come into my first year class trying to recruit people to work, and they haven't even finished their education. They would be going into work in an agency where they don't have any background knowledge on anti-oppression, fully on working with homeless people, the context of homelessness. And so their understanding may not be at the same level as someone who's deeply, deeply entrenched in this, has been doing it for a long time and, has had that full kind of learning. So there's not that common knowledge. That's okay. I just think it's important that we acknowledge that. And so when we're talking to our staff, you have to have a lot of nuance and care with this, understanding that we are both in a position of power over them, but we also need to bring them to a place on side where they are acting in an anti-oppressive fashion, where they are understanding of homelessness in its context, and there isn't any accidental harm being caused to people as a result of that. So this requires a blend of public messaging and interpersonal communication skills. And what it really means is that we cannot alienate our staff, tell them that they're wrong, tell them that they need to shape up, force them to go to a training. I think what's important here is that we're trying to solicit buy-in from them. We're not judging people or telling them that they're wrong and they need to change how they do things right away. Because has that ever worked on anybody? If you have a small kid and you say, don't do that, do they stop doing it? A lot of the time they don't. They keep doing it more. So generally speaking, when you tell someone to not do or think something, they sometimes double down uh, in those attitudes. So think of it as trying to get buy-in as opposed to just forcing alignment, even with your own organizational policy. So your broad communications when you're talking to staff and groups, underpin that with empathy and understanding of the work that they're doing, that it is really hard, that it's very emotionally debilitating. That's also oftentimes very physical as well. It is hard, tough work. I know, I've done it for so long. Really, really, really make sure that your staff know that you know that, right? That we're recognizing the labor that they're putting in and that it is very, very tough to do. And make that space for those one-on-one interpersonal conversations that, again, are not criticizing or chiding people for their attitudes, but making that open space to have a real dialogue about the real issues that underpin homelessness. It's the best advice I can offer, but I also really want to say that this is not the full advice. There's so much nuance to these kinds of situations, and I'm sure there may be questions about it as well. So if you haven't read the guide, here is the guide. Well, it's a photo of the guide, but it is online, and I'm sure someone can put a link in the chat. And I hope that it's actually very useful and helpful to you. So that kind of concludes that particular portion, which is to say the presentation portion. And so I really want to make space for any questions, comments, concerns, denunciations you might have. And I'm so sorry, it's such a bright light behind me. I actually can't move, so I apologize. So half my face is just blinding white light.